Hello doctors, welcome back to Jabstudiesmetfun. I'm Dr. Aishwarya Mukkal and this is your fourth part for the community medicine important PYQ images. So let us start with our first topic, that is biostatistics. In biostatistics, we'll be looking at the different types of representation of data. You'll just have to identify the pictures and the kind of data that they represent. So the first kind of data that we'll talk about will be quantitative data. The first image over here is histogram. So what exactly is a histogram? It's very easy to identify. First you have to see it's a bar graph which is a continuous representation of data. So the first four images over here, they will always represent continuous data. You have to remember that. And the type of data that they represent is quantitative data. The first one we have over here is histogram. The second one is frequency polygon, and the third one is frequency curve. So what's similar between these three is frequency polygon and frequency curve are derived from the histogram. So they will take the midpoint of each value of the histogram and then either they will draw lines from the midpoint, that is the frequency polygon, or if they draw curves, then it is a frequency curve. The fourth one we have over here is the line chart, where different kinds of lines are used to represent different parameters or values in the chart. The next one we have is scattered diagram. In a scattered diagram, there will be multiple values which will be put onto the graph as points, and then a line or a curve will be drawn through them to derive a relationship. So for example, over here you can see that the line that is drawn is going linear upward, another has a curve, and another has the fourth one has some sort of like stippling on the graph without any relation of the values. So that is what is a scattered diagram. What we have next is a qualitative data. In qualitative data, the first one here is spot map analysis. Spot map analysis is basically spotting on the map where different values will be represented in different kind of colors. For example, this map over here, it represents COVID-19 cases in India. The next one we have is pictogram, which is pretty redundant if you look at it in from the perspective of community medicine. But the thing is, it's important to know what kind of data it represents. So it represents a qualitative data. The next we have is bar chart. There are two types of bar chart over here. One is simple and the other one is multiple bar chart. In multiple bar chart, if you want to compare two different kinds of values, then we make the multiple bar chart. And bar graph is one of the most easiest forms of representation of data. Next we have is pie chart. In pie chart, you have to remember that the total value of the data represented in total, it will always be 100%. It has been asked in your exam before. So that's it for biostatistics. We'll be starting our next topic, that is environment and health. The first image we have is of a rapid sand filter. So what is a rapid sand filter? A rapid sand filter is a purely physical drinking water purification method, and it is used in mostly rural areas. It provides rapid and efficient removal of relatively large particles. So one step above the rapid sand filter is a slow sand filter. So in a slow sand filter, you can see that the water purification system, it uses a bed of fine sand to treat raw water and produce potable water. So it is simple and cost effective, and it is also used in rural areas. The very important term to note over here is Schmutzdecke. So what is Schmutzdecke? Schmutzdecke is German for dirty skin. It is a gelatinous substance, gelatinous layer forming on the sand surface, which traps particles and degrades organic matter. You can see it over here in the image, where all the particles from the raw water, like all the impurities from the raw water, will be trapped inside a gelatinous layer, and that will lead to the production of potable water. Next we have is the Venturi meter. You might have seen these blue colored boxes on top of pipes. So it is a device that measures the rate of flow of fluid through a pipe, and it is based on Bernoulli's equation, which can also be asked in your exam. Bernoulli's equation. Next image over here is a recent PYQ. It's Horrocks apparatus. It is used to measure the chlorine demand. That is the amount of chlorine required to kill pathogenic organisms. So it is calculated using Horrocks apparatus, and the indicator used is starch iodine. And the formula for it is the amount of bleaching powder that is required, that is your that is the chlorine demand, is equals to n multiplied by 2 grams for 455 liters of water. So what will happen is you'll put the reagent in the sample water, and n is the number of cups that is required to change the color of the reagent. So for example, if 2 cups are required to change the color of the reagent, then your n will be 2. So 2 multiplied by 2 grams, that is 4. So 4 grams of bleaching powder will be required to clean that particular sample of water, that is 455 liters of that particular sample of water. Next we have is the chloroscope. Chloroscope measures the free residual chlorine in water, and the break point is the point of appearance of the free residual chlorine. You just have to remember this image, and the difference between these two images is that in Horrocks apparatus there will be cups given, like the cups are of a certain measure, so you can remember it by looking at the apparatus that is provided. It has cups, then it's Horrocks apparatus, and if it has different kinds of uh, gradations of color, of yellow color, then it is a chloroscope. Next we have is oxidation ponds, another recent PYQ. So these are open shallow pools of 3 to 5 feet deep water. They are used for the treatment of sewage and industrial waste. During the day, aerobic oxidation takes place in oxidation ponds, and during the night, anaerobic oxidation takes place in the ponds. Our next topic is biomedical waste. So here are given some samples of images. These are actually the logos for biomedical waste and ionizing radiation. You need to know the difference between these, because during the exam you might get confused really quickly between these two. So the ionizing radiation comes with a yellow colored circle with a three winged wheel inside it, and you can see the difference that biomedical waste logo is quite complicated than ionizing radiation. The first image down here is the incinerator. So what is an incinerator? It is a dry oxidation. It produces dry oxidation at high temperature, and it is used for yellow, that is non-recyclable infectious waste. So yellow colored bag waste will always go to the incinerator. And the most important thing is, what is the temperature at which the incinerator does the dry oxidation? It is 1050 to 1200 degrees Celsius. Our next device here is the screw feeder. What is screw feeder is, you put sharp infectious waste in it. So basically the infectious waste that is put in white colored bins, that is put in the screw feeder. So the disinfection is by heat, not by burning. We don't burn it, we heat it. And there is a rotatory auger down here. It is like, we'll zoom in here. So this is the rotatory auger. It is like a spring. It looks like a spring, but it's actually, it rotates and it crushes the sharp infectious waste, which will decrease the volume by 80%, and the weight is also decreased by 20 to 35%. We have a very important image over here, that is the segregation of hospital biomedical waste. Why is this important is at least one question from this is asked every single year. So please pay attention to this particular topic. The first one is green colored bins, which include your general waste, like kitchen waste, like anything that comes from your kitchen, that comes from food waste, and any general sort of waste will go to the green colored bin, that is non-infectious. Next we have is the red colored bin. In the red color bin we'll put infectious plastics like gloves. For example, we can also put like blood bags. And the next one we have is infected waste, yellow color, which will go to the incinerator, mind you. It includes everything. For example, it can include specimens from the operation theater. It can use any, basically, cytotoxic waste, anything that comes out of your patient's body, that will be put in the yellow colored bin. Next one is blue. It will include all kinds of glassware, like any medicine bottles, any vials, or if you are using any part of your implants or glass, all of it will go in the blue one. What will go in the white one as the syringes, like needles, everything sharp will go inside the white colored bin. Next topic we have is epidemiology. In epidemiology, it's pretty simple to remember because all of this has been repeated multiples of times. The first topic we have is epidemiological triad. The only thing you have to remember are the components of the epidemiological triad. The three components are host, agent, and environment. In epidemiological triangle, we'll have one more addition to the components. Host, agent, environment will remain the same. The most important thing that is added over here is time. So how does time change it from an epidemiological triad to epidemiological triangle? Time is factored in because of its importance in the pathophysiology of a disease. For example, time can also impact the prognosis of a patient. For example, at the time at which the diagnosis was done, the time at which the treatment was started, the time at which, you can say, basically any parameter or any factor that is related to time can also make a huge difference in the prognosis of the disease or the epidemic of the disease. So that is why time is factored in, and hence it becomes an epidemiological triangle. The third thing we have over here is the web causation theory. Now there is a huge confusion between web causation theory and multifactorial causation theory. So what is the difference? The difference is, first we'll look at the multifactorial causation theory because it is relatively simple. So in multifactorial causation theory, what happens is you take one cause and it will directly give you the effect. For example, if a certain patient has a genetic defect, it will directly give you the cause. The result of the genetic defect will be a disease, and it will literally show up directly. Uh, in this, there can also be other factors. For example, their psychosocial condition, their economic condition, but it will directly impact the emergence of the disease. However, in web causation theory, the different factors or the different causes will affect each other, and ultimately they'll give rise to the disease. So multifactorial directly gives rise to the disease, or in the image it is depicted that it directly gives rise to the disease. And in web causation theory, you can see there is a web of different kinds of causes. You can remember it like that. The last thing we have over here is the iceberg phenomenon. In the iceberg phenomenon, the thing is, you can see that the iceberg, or the part that is ice, are the affected cases, and the water line is the demarcation. The water line is the demarcation between detected and undetected cases. The visible cases are the ones that are diagnosed. The visible cases are the ones that are caught. The tip of the iceberg are the ones that are actually the clinical cases. Like they are the definition of the disease. The part which is submerged, the ones that are invisible, are the misdiagnosed cases, undiagnosed cases, Subclinical cases, asymptomatic, pre-symptomatic, or susceptible population, the one who are exposed or the one who have the risk factors. So what is the water? Water are the healthy individuals. Highly anticipated question. Please remember that the water in the iceberg phenomenon are the healthy individuals. So that's it for today. So we are done with the fourth part for community medicine. Thank you. Please keep coming back to Jabstudiesmetfun.